Welcome to today's session titled Advancing Social Connections for All. Before we get started, I would like to go over a few items so you know how to participate in today's event. When you joined today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. You will have the opportunity to submit text questions to the presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce Lindsay Goldman, CEO of Grantmakers In Aging and moderator for today's webinar. Lindsay?
Welcome, and thank you for joining us today. I'm Lindsay Goldman, the CEO of Grantmakers In Aging. We are a national membership organization of philanthropies that acts as a relevant and responsive network, resource, and champion for aging-related issues and investments. Our vision is of a just and inclusive world where older people are fully valued, recognized, and engaged in ways that matter. We are pleased to present today's webinar alongside our colleagues at Grantmakers In Health, a nonprofit educational organization dedicated to helping foundations and corporate giving programs improve the health of all people. And I would like to thank the Archstone Foundation for their support of today's webinar. And speaking of Archstone Foundation, they are also the premier sponsor of our upcoming conference. We'd love to see all of the funders on the call with us today on October 13th through 15th. GIA conference is fully virtual, and we have a really exciting lineup, so please register. In recent decades, people of all ages have experienced soaring rates of social isolation, with profound impacts on health and well-being. Far from being a personal choice, social isolation stems from community designs and systemic injustices that keep people and neighborhoods apart. We must reshape our communities in ways that support meaningful social connection among residents, improve trust between neighbors, and strengthen an overall sense of belonging and community. A recent report by Healthy Places by Design entitled Socially Connected Communities, Solutions for Social Isolation offers 5 recommendations for creating socially connected communities, starting with public spaces, transportation, and housing. We are joined today by an expert panel who will discuss how philanthropic leaders can support the redesign of community-level systems to increase meaningful social connections. Joining us today, we have Risa Wilkerson, Executive Director of Healthy Places by Design, Amy Gorn, Program Officer of the Matsu Health Foundation, and Sharon Roerty, Senior Program Officer of the Robert Wood Johnson Foundation. Thank you for being with us today. We will share the slides and videos of today's program on our website. Please submit your questions during the presentations and we will address them at the end. I'm now pleased to turn the program over to Risa Wilkerson to start us off. Risa?
Thank you, Lindsay, and thank you everyone for being here. I'm looking forward to the conversation with you. So today, as was mentioned, we are talking about socially connected communities. Next slide. And just so you know who we are, I'm the Executive Director of Healthy Places by Design. We are a nonprofit consulting firm that works to advance community-led action and proven place-based strategies to ensure health and well-being for all. We partner with health-focused funders and others to provide technical assistance to community leaders and coalitions, and we coordinate collaborative learning networks, which is one of the ways that we came to this conversation today, which you'll hear more about shortly. Next slide. We'd love to start with the positive. So why socially connected communities? Well, because they're good for us, because people who live in socially connected communities are more likely to thrive because they feel safe, welcome, and they trust in each other and their government. Trusting meaningful relationships enhance our physical and emotional and mental health and well-being. In fact, as you see on the screen, it can really boost a person's lifespan by 50%. Yet leaders who strive to create resilient, equitable, and healthy communities often focus on physical and mental well-being, but neglect to incorporate social connections, even though it's a vital contribution to our health and well-being. Social well-being is the strength of a person's relationships and social networks and is strongly linked to social inclusion and a sense of belonging. Next. Two terms are often conflated. That's loneliness and social isolation. They're clearly related, but they are not the same. And it's really important if we're going to engage in this conversation to understand the difference. Loneliness is the feeling of being alone, regardless of how many people are around you or the amount of social contacts you have, while social isolation is the actual lack of social connections, both at the personal and interpersonal and community level. The conflation of these terms is linked to how social isolation is being defined, discussed, and addressed primarily through an individual lens rather than a systemic one. So think of the terms that label socially isolated people as hermits or loners, or as it's a consequence of choice. Next. This is really important because the rates of social isolation are soaring globally and they have profound impacts on health and well-being. So as you'll see here on the screen, folks who are socially isolated are at high risk of premature mortality. It's been linked to smoking 15 cigarettes a day or having alcohol use disorder. It's twice as harmful to physical and mental health as obesity. It's linked to depression, poor sleep quality, accelerated cognitive decline, impaired immunity, increases in suicidal ideation attempts, increased risk of stroke, and so on. So it's a really important issue for us to discuss today. Again, these rates are soaring. In 1985, there were 10% of adults in the US who said they had 0 people in their network with whom they could discuss important matters. That went up to 25% in 2004. In 2018, more than half of the adults in the US said they had 1 or 0 confidants. And of course, that was well before the pandemic. Next slide. So I'd like for you to, for a moment, close your eyes, because I want to list for you the life experiences that exacerbate social isolation and have you imagine in your mind as I read this list, people you know who might fit these experiences. So long-term illness or disability, domestic violence, loss of a loved one, becoming a caregiver, having a baby, moving to a new place, migration, being rejected by family members and peers when coming out as LGBTQ, someone who's re-entering society after being incarcerated, homelessness, living in rural environments and communities, being an immigrant, or an individual or family struggling to make ends meet. You can open your eyes. I imagine if we were together and I asked you to raise your hands if you know people who've been in these situations, almost every hand would raise in the room. Social isolation is incredibly widespread, and it's most susceptible for people who feel they don't belong to majority social groups because of their gender identity, their race, ethnicity, or sexual orientation. So imagine the impact on those experiencing intersectional marginalized identities, like being Black, living in a poor community, and a rural community. Next slide. That's why it's so important that we recognize that social isolation is not a personal choice or an individual problem, but one that is rooted in community designs, social norms, and systemic injustices. Next slide. We have designed systems inadvertently or intentionally that have led to isolation and oppression. The list on the screen is just a few of the systems designed this way, and we will talk a little bit more about just 3 of these for now, but imagine all of those that you are in contact with and begin to think about how those systems are designed in ways that isolate people and neighborhoods. Next slide. So the first space we'll talk about is public spaces. So buildings and public spaces are often inaccessible for people with disabilities, making their participation in public life difficult or impossible. Some public spaces display historic symbols or artwork that favor certain races or worldviews while omitting or offending others. Systemic racism and oppression can make it unsafe for BIPOC, LGBTQ, immigrants, and others to safely gather with friends and family. And as I go through a few of these examples, I welcome you to add other examples into the chat box that you're noticing or see. Next slide. For housing, we've had a history of public policies such as redlining that have created racially segregated neighborhoods where discriminatory lending and other practices have stymied home values. This isolates minority students in poverty-concentrated schools and produces extreme wealth disparities. And in the US, we've passed laws like anti-loitering laws that effectively make homelessness and poverty a crime and results in the forced removal of people from public spaces. Next slide. We have a history of highway development that has split communities of color, resulting in a legacy of severed social networks and polluted neighborhoods. Travel by anything other than car is often stigmatized, and related investments often bypass low-income communities which would benefit the most. Pedestrian fatality rates are disproportionately racialized. And we know in our rural communities, transportation is a real issue that challenges folks to be able to access medical and social services. Next slide. Again, what have you learned from the communities you work with about the structural drivers of social isolation? Those were just a few small examples, and we're limited to a few sectors. But if we think about how all of our systems have been designed, there are many examples we could offer. And I ask for you to share a few of those in chat. Next slide. So, as Lindsay mentioned at the top of the hour, we were lucky enough to work with a group of about 60 practitioners last year, and we talked about the experiences they were having, especially during COVID, trying to bring people together and reduce social isolation. And what they were learning, what they were seeing in research, what was missing from the conversation. And collectively, we agreed that it was important to sort of shift the narrative toward this systems lens and develop a few recommendations as starting points to not be the encyclopedia of solutions, but to just begin to initiate conversations so that people could take, a few examples that we're sharing here and really run with it and figure out ways that this could work for their communities. So the first 3 recommendations are sector-based, and we chose these sectors, housing, transportation, and public spaces, because they are the sort of anchoring point for our lives. We start in the house, we leave the house, and we enter the transportation network, and very quickly into public spaces. And these 3 offer us access to education, healthcare services, and more. So that's why we started with the first 3. And then we all really wanted to keep put in here very front and center the need for inclusive practices and community-led solutions, and then also making social connectedness a community norm. So I'll walk through very briefly what each of these recommendations looks like, just so you can get a little peek inside of the report. So first, we'll talk about public spaces. Next slide. And in here, we talk about co-creating inclusive, healthy public spaces that are designed for all ages to gather and have social interaction. We encourage intergenerational exchange, for example, by co-locating services for different ages, developing policies that decriminalize loitering and enable the innovative use of parks and public spaces. So for example, in Buffalo, they permitted winter fire pits in parks so that people could enjoy, even in the colder seasons, coming out and spending time together. Next slide. We also talk about housing and strengthening and safeguarding inclusive, affordable housing through zoning and other design measures that help residents to gather and make social connections. So for example, housing first strategies that include wraparound supports, co-locating parks with affordable housing wherever possible, and then having both mixed income and mixed use housing wherever we can. This creates more diversity of community, reduces the stigma of public housing, and improves access to various services and resources. Next slide. We encourage people to think people first with transportation systems, so prioritizing movability, walking and bicycling networks, public transportation of all kinds and types, even in rural areas where we can, lowering traffic speeds and air quality control. Thinking about creative uses of transportation facilities. So for example, play streets doubling as summer food sites or little free libraries at bus stops. And policy levers. We learned about a policy in Sweden called gender balanced budgeting after they did some research and realized that their snow clearing practices were disadvantaging women who were more likely to walk. And now they prioritize snow clearing in front of schools and daycare centers first to help in that way. Next slide. The recommendation around community-led solutions really talks about the importance of shifting power to community members, elevating practices rooted in culture, harnessing a variety of creative communications channels, and of course, creating universal broadband access, especially in the rural areas where that is lacking and prohibits folks from accessing telemedicine, for example, or connecting by Zoom. Next slide. Finally, the last recommendation is around social connectedness as a community norm. So we lifted up the idea from a health affairs article by Dr. Julianne Holt-Lundstedt of using social in all policies as a framework, at least a lens by which you think about every strategy, practice, policy that's there. Implementing trauma and resilience informed practices and then declaring community values. This is already being done in communities, for example, that are declaring themselves as compassionate cities, stigma-free zones, and so on. Next slide. So we're here to think about how philanthropic leaders might support the redesign of community-level systems in order to advance meaningful social connections. And for that, I'm so honored to be joined by Amy Gorn and Sharon Roerty, and look forward to hearing their take on that. Amy?
Thank you, Risa. My name is Amy Gorn. I use she, her, hers pronouns. And the Matsu Health Foundation is a place-based funder in Alaska's Matanuska-Susitna borough. And so I want to first acknowledge the lands on which I have the honor to live, work, and play. My residence is in Benta, known as Wasilla, the ancestral territory of the Dena'ina and Otna peoples. I offer my reconciliation and respect to their elders, past and present. Thank you for the honor to share with you today about the social connections work we intentionally support and address in Matsu. I humbly represent parts of our work being led by incredible colleagues. The report by Healthy Places by Design has been energizing for me as I share it with my colleagues. This is what we're doing and what we want to be doing for systems level changes and for public health. Next slide. Next, thank you. The Matsu Health Foundation is a nonprofit that ran a hospital in our borough. A new larger hospital was needed nearly 20 years ago to meet the population needs, but we didn't have the capital to do it. So we entered into an LLC partnership with a for-profit hospital subsidiary to build Matsu Regional Medical Center, which is pictured in the background here. And we jointly governed that hospital. The foundation then takes our share of the profits and invests them in the form of grants and scholarships to measurably improve the health of our population, which is located in the area shown in red on the map. Our building, pictured in the top circle, opened about 3 years ago with a goal to be a trauma-informed space where community meets prevention, and that can be through our tenant roster and with meetings and events hosted on site. Next slide. The Matsu borough has over 100,000 residents, the majority of whom live in a 10-mile radius. So there are very suburban areas and very rural areas. Our borough is geographically the size of West Virginia. The Matsu has been the fastest growing area in Alaska for a while also the fastest growing older adult population. Next slide. For this work, we started out rather easily, seeing that the population is geographically spread out. People must put in effort to go anywhere, be it where they choose to go or out of necessity. And there are people who say they moved here or choose to live here in more secluded and private areas to purposefully have less government and societal impact in their lives. But yet we often assume that that privacy is desired. It is winter here most of the time, and with that, darkness. There is a lack of free and accessible activities. There's gaps in broadband access across our borough, and a lack of transportation and other resources. We have a pretty transient population and definitely a commuting population. Thousands of workers drive away daily about 50 to 70 miles to Alaska's largest city of Anchorage. So this high percentage of workforce does not spend full days in their community of residence. These are visible conditions to us. Next slide. As a nonprofit hospital in the eyes of the IRS, we're required by the Affordable Care Act to conduct a community health needs assessment every 3 years. So what's shown here is that social connections first appeared as part of a goal in the 2016 Chana. Then social connections featured more prominently in our last Chana in 2019. As we heard the community lift social well-being, these goals then landed in our implementation plan, and that holds us accountable. As you can probably see here, in 2019, our learning went further than previously. The report echoed what Risa has said. Research shows having a high level of social connections can have a preventative effect on warding off mental and physical health problems, along with promoting positive health behaviors across the lifespan. This is a preventative approach we factor into our investments. Next slide. For the 2019 Chana, we included a community project using photo voice and called it Hearing Every Voice. A dozen different community groups formed to take pictures of health in community and the challenges and barriers to health. Social isolation and connections were featured and called out. This helped us to learn more about the root causes of social isolation in Matsu. Next slide. There is a Matsu neighborhood called Willowa that does not have representation like a community council. And over the years, there's been a high drug and crime presence in Willowa, and no jurisdiction has stepped in to organize or to help Willowa to organize. It became an area with squatters and where kids were afraid to go to their bus stop for fear of harassment by drug users. Then neighbors began to interact, set cleanup goals, and even incorporated a small nonprofit. With cheerleaders on their side like a Rotary Club and the Health Foundation, they've begun making environmental changes and transforming their neighborhood, as you can see in these pictures left to right. Children were prioritized, safe routes were created for Halloween night, and now a community gathering space has been built with a playground and a pavilion. What if neighbors do not interact with each other? What if they are connected? Willowa residents joined our Photo Voice project, and through that, we've been fortunate to learn about the lack of neighborhood representation and its impacts, and much more. Next slide. Now to share strategic examples. The Matsu Health Foundation serves as the backbone for Matsu, Raising Our Children with Kindness, which is a cross-sector collaborative using the collective impact framework to strengthen Matsu families so all children thrive in a safe, healthy, and equitable community. The goal is to end child abuse, neglect, and reduce adverse childhood experiences. We have data about the high level of ACEs among Alaskans and Matsu residents. However, connected families can be resources to each other and access concrete supports in times of need. Families can be resilient through tough times, thus reducing risk factors for child abuse and neglect. To foster connections, ROC has hosted primary prevention events such as community kids dance parties shown here, which has been particularly helpful, we've heard, from grandparents who are raising or who are primary caregivers for their grandchildren and who are eager to interact and find supports. ROC also hosts an annual community baby shower to welcome Matsu's newest residents. ROC's Social Connections Coordinator is currently planning to implement a model for having open conversations in Matsu to unjudge each other. Next slide. As of a couple of years ago, Matsu now has Youth 360, following a community tragedy years ago that painfully pointed out the social disconnect of some youth in Matsu. The Health Foundation, our local United Way, ROC Matsu, and our local school district sought a way to connect and prioritize young people. We turned to Iceland for inspiration with their decades-long transformation on youth well-being. As a community collaborative, we applied to Robert Wood Johnson Foundation for a U.S. adaptation of the Icelandic prevention model to reduce social isolation for local youth. And that has been very exciting and going really well. Next slide. And next here, we found that we have a need for a local community resource center, and that was identified and prioritized in our 2016 CHANA. Connectmatsu is that resource center, and it is a concrete connection between community and its assets and resources. And it's beginning to work on community level conditions, specifically housing needs and reentry population. Connectmatsu strives to connect with people without traditional connections and then learn what opportunities may look like for them. Connect hosts a community calendar of happenings. The snapshot of that is shown lightly there in the upper left. And that is a collaboration with ROC Matsu's Social Connections Coordinator. This next year, Connect will begin to develop a community welcome program to provide information and referral services to the new residents of Matsu, thereby increasing belonging, to positively impact health, and to retain our workforce. Needs and requests that are presented by the community to this resource center will also inform gaps for philanthropic partnerships and future investments. And I'd like to note that the Health Foundation, ROC Matsu, Youth 360, and Connectmatsu all have their offices in our building. Next slide. In my last examples here, Talkitna is a town of around 1,000 people near the base of Denali, North America's tallest peak. This town is situated in the northern rural part of our borough. And to serve this large spread out area, a transit network was formed simply through the donation of an older van. Now this service is its own transportation system, increasing access to resources, transporting elders to medical appointments shown here, and bringing youth to after-school programs. The Health Foundation has previously granted to the provider to support leverage of federal transportation dollars. There's also a public space in Talkitna's in their compact downtown area. And a couple of years ago, through community organizing supported by ROC Matsu, residents volunteered to reclaim this public space from intimidating and possibly illegal activities. So planning, welcoming, and family-friendly activities and events at this public space edged out danger and has given people a reason to linger and to run into their neighbors, all blending of social economic differences. And it's these connections among a small populace in a rural area that have helped actually create and sustain community systems. Next slide. To summarize, we start by seeing what we see and think we know, and then we research, and we go further and listen to community, make strategic investments, take some actions, try to build and share power, examine, and then ultimately embed the value and need for social well-being into all that we plan for and invest in. The Healthy Places by Design recommendations provide to us a logical and intentional framework for furthering our work by engaging with our Matsu communities. Thank you, and I will now turn to Sharon.
Thank you, Amy, and thank you so much for your presentation. I love the stories of Willowa and Matsu. They're so inspiring, and they really lift up what Risa says, which is, you know, we have to focus on the positive and look at community assets. And we learned that across all of our grantees in this cohort that I'm going to speak about. So hello, everybody. Thank you for joining us. Sharon Roerty here. In the slide, you see we're committed to building a culture of health. That is the tagline of the Robert Wood Johnson Foundation. I'm a senior program officer there. So let's start with what is culture? Culture is food, art, song, dance, family, friends. It's about caring. It's a mindset, right? For us, culture of health is rooted in health equity that provides every individual with a fair and just opportunity to thrive, no matter who they are, where they live, or how much money they have. And health to us is so much more than a visit to the doctor. Oh, next slide. Good ideas have no borders. That's the tagline of the Global Ideas for U.S. Solutions team that I am a part of at the Robert Wood Johnson Foundation. We know that that to help everyone in our nation, we have to go outside the U.S. and look for good ideas, look for policies, practices, things that are working that we think we can bring back to the U.S. for adoption and adaptation, and replication, and inspiration. With that in mind, we work with organizations across the globe to uncover ideas and solutions from beyond our borders. Next slide. So a few years ago, we had a series of roundtables and discussion groups, you know, back in like in 2017, when you can actually meet with people. We did a bunch of whiteboarding and all of that to really source what are some of the most pressing problems in the US and the world. And the thing, you know, after having hundreds of ideas, the one that kept perking up was social isolation. And for me and my team, what was surprising is we knew social isolation was a problem in the US. We just didn't know that it was a problem around the world. So with this work, we went on to develop a call for proposals where we were seeking ideas from folks inside the US that wanted to borrow ideas, if you will, from outside the US that were already working on social isolation. Next slide. We heard with that call for proposals, we've got over 200, over 200 applications. We heard about a wide variety of global models for addressing social isolation, which generally fell into one of these 6 categories you see on the slide. Some examples of them included community outreach. And community outreach, we heard about the Friendship Bench, which was created by Dixon Chibanda in Zimbabwe. And that's a program that's been adopted and adapted in in the US and lots of places and other countries around the world. There's a training manual that's been developed. It's Friendship Bench at zimbabwe.org. And what that really does is bring therapy to people right in their own in public spaces where, you know, they feel comfortable talking with someone else. Lay people are trained to talk to others about their problems, the challenges they're facing, and what the community assets and resources are that they can possibly access. Another one of our examples that perked up just in sourcing these ideas was under social spaces, the Men's Shed, which originated in Australia as a way to improve well-being and reduce loneliness among older and retired men. So these are just some of the ideas. And next slide. With our CFP, as I mentioned, we got over 200 ideas, and they pointed us to opportunities for addressing social isolation, including the need to raise the visibility of social isolation and its root causes, and to continue to build an evidence base around promising interventions. One of the things that was somewhat surprising to us is that the research for social isolation was somewhat thin, and we're also trying to bring light to that. Next slide. We developed a report and it sort of brought together some of the lessons that we learned from that early work, and it's we made it available. It's available online, and on your slide you can see where that is, how to access that report. We could also put that in the chat. Next slide. We ultimately funded 6 projects that brought ideas from Iceland to Alaska, and you just heard about some of those ideas from Amy, from Brazil to Baltimore, and the United Kingdom to New Jersey, and lots of other places. A few months into the grants, just as COVID hit, we got these grantees together to share lessons across their work. And we brought in Healthy Places by Design to facilitate what we called a learning network. Those conversations led to the co-creation of the report that we've been talking about today. Risa mentioned it early on in her presentation. And I'll just stop and say for a moment, it was, we didn't think we were going to, we do a learning network, but with COVID, we couldn't meet in person. We couldn't do the convenings that we were going to meet. So we thought about how to do this, and it's kind of an idea that sprang up organically, but it actually couldn't have worked out better, I think, with our grantees sharing ideas with each other, and then sort of reaching out and having these smaller circles online, if you will, but smaller circles of sharing ideas and hearing people's challenges and what they were doing to work through social isolation. So I want to thank Healthy Places by Design for doing that work with us and all of our grantees. Next slide. With that report, we have an accompanying action guide that lays out 6 areas for philanthropy. At the Robert Wood Johnson Foundation, we've been particularly focused on the first one, which is integrating social well-being into all of our investments. We're not going to be launching a whole new focus area around social isolation, but we realize that it's an important thread that is woven across all of our work. So we've been talking with our colleagues about where those intersection points lie and how we can bring social well-being forward in our work. For us, it's a work in progress, but we're uncovering a lot of important connections and opportunities to integrate well-being into our efforts to improve health and health equity in the United States. And it might be a way for you all to think about your work and how you bring it in too. If it's not a vertical of funding for you or an area of concentrated funding, how do you really weave it into your work? So with that, I'm going to turn it back to Risa and remind you, if you have questions, to please put them in the chat so we can get to them. Risa?
Thank you so much, Sharon and Amy, both. It was a pleasure hearing from you and being reminded of some of those stories. I'm going to close out this section here with a couple of slides around imagining the future that we want. You're welcome to look at the slides or close your eyes as I describe this different type of community to you. And then we'll open it up to some questions. So imagine a socially connected community where people know and trust their neighbors and people from different neighborhoods, where they are motivated and supported to be civically engaged, where structures, policies, and relationships connect residents to important services, resources, and inclusive spaces. Next slide. And where people see themselves in the design, art, options, and practices represented, and they feel welcomed in their community. Next slide. During this pivotal moment in history, it is more important than ever for local leaders to work with philanthropic leaders and others to create socially connected communities. This priority can help address past and current dramas due to structural and systemic oppression and build more cohesive, resilient, and equitable communities where everyone is able to thrive. Next slide. So getting started in your community or with your communities, we would encourage you to share the report and the action guides, to be a neutral convener and host some conversations in your community about what is a socially connected community and how are we already doing that here and how could we do that better. To use the report as a launching point or a kickoff to brainstorm ideas about community level solutions and to help advance the field by supporting more research, additional tools, and definitely helping to change the narrative and lifting stories. And we welcome your stories and any feedback as well. We're hoping to create an updated version of this report in the future and create some missing components, for example, more around rural areas and others, and would welcome any ideas that you have for that. That's the end of the slide. We can go back to questions now. Thank you so much.
Thank you to all our panelists. If I could ask for them to turn their cameras back on so we can begin our question and answer portion of the program, and we've gotten lots of really good questions. So the first question is, recognizing that social isolation, the root causes are so often systemic, to what extent are we seeing other kinds of professionals and sectors appreciating the value of connected communities? So where are the planners? Where are the architects? Where are the transportation people? Who's driving this movement in addition to all of you on this call?
I'm happy to start, and then I welcome Sharon and Amy, any thoughts that you have. But I really think, public health has been the driver of it at the moment. It's a relatively nascent conversation. I think we all have known for a long time the importance of collective action and of trusting relationships, and we've talked for a while about community-led solutions and shifting power to community members. But this broader conversation about from every person to, in a community feeling these strong social networks and having good, meaningful, healthy relationships has not been a part of the conversation. And so I think, it's really is starting in sort of this public health realm. However, I have, since the report come out, spoken to county officials and managers and mayors of cities and others who are super interested in it. I think the pandemic has raised all of our awareness of the detriments of social isolation and not having, connection with people that we know and love, and meeting new people, being part of community events and feeling connected to people we don't know but who share geographic proximity or other things with us. And so I think that it is as much about raising awareness and keeping that conversation, present as it is about anything else. It is not a hard sell. That's what I would say. Sharon or Amy?
Yeah, thanks, Risa. You really covered it. But, it's almost, when you ask the question, Lindsay, I'm thinking, well, who's not driving it? It is sitting sort of in the domain of public health, maybe in terms of the research and thinking about it and organizing around it. But sure, planners, architects, I've worked with, plenty of them that are thinking about this. But I think Amy, brought up some great stories from Alaska, and I think community people are driving it. They're rising to the occasion because that's not what they want in their community. So they're the drivers of the solutions as much as anyone. And, I think the reports and the solutions that we've surfaced and, to dig deeper, anyone can really drive the solution. It's not something that you have to wait and put in the hands of the professionals.
Well said, both Sharon and Risa. And I'll just add that as we think about what this community welcome program, Connectmatsu, in our community will look to develop is the workforce. Workforce is a huge consideration in all sectors right now in our country. And we're feeling that in our community. And some of our biggest employers are our local school district and our hospital, our medical sector, healthcare workers. And if we have people who want to stay in our community and feel that they belong to it, they'll continue to work here. Or if new workers are going to come in, those employers will want to think about, hopefully, the way that those employees connect to what is important, what fulfills potential for people, what are their needs, personally that they want in somewhere where they live. So we want to help connect people to that as well, so that it helps with our workforce retention as well.
Thank you. And that's actually a perfect segue to our next question, which is about public awareness. And so, we have seen increased attention paid to the negative social, physical, mental health outcomes associated with isolation. And so I think that one of the strategies that has been employed is this idea of a public awareness campaign. But beyond saying it's really, really bad to be isolated, it's associated with all of these terrible things, what's the action item? Given that we've acknowledged that a lot of the root causes are systemic, but if we're talking to the public, what's the ask? What are we asking people to do for each other?
I think we're asking people to, it comes back to something that we've all said, creating a sense of belonging. So, where do you do it in your community? Where do people feel like they belong? Hopefully every community has something where people gravitate to. But and to find that spot, how are people gravitating? Where are they gravitating to? And then, is everyone welcome there? Is it 60% of the population, and who's left out? What are the assets people like? So it's really thinking about I have to keep coming back to the assets and the people of the community. Do they feel like they belong? In our winter mission project, they were one of our grantees. It was, a large part of that project. It took place in cities in the northern part of the U.S. And it really looked at, okay, if you live in northern Minnesota, you might, ice hockey and ice fishing might be normal activities for you. But are there new populations that have moved here? What are they doing? How do they feel like they belong? If they want to participate in these activities, do they have the equipment? Oh, we can set up a shed where they could borrow that equipment. We can put that equipment in the library. And these are some of the things they did, or mark the trails so that people can go to the trails. Risa talked about, in Buffalo, setting up fire pits. So thinking about that draws people out, that really does create that sense of belonging, not just for 20% or 30% or even 60% of the population, for all the population. That's really what people can do.
And Amy, I love what you said about, oh, go ahead.
Oh, go ahead, Lindsay.
I was just going to say, I love what you said about the annual community baby shower. I think that's just brilliant, and creating, new community rituals. And I wonder, are there similar rituals in later life that you're seeing people start to acknowledge? Because oftentimes as we age, we don't have as many of those kinds of rituals and opportunities for celebration.
That's an excellent point, Lindsay. And I will say that the community baby shower has become such an uplifting and popular event. They've had to get creative through COVID in what used to be a big in-person party. But outside of that, I think absolutely there's great opportunity to think about certain milestones or celebrations throughout the lifespan. And we haven't fully gone there, but one simple example that I'm sure many of you have probably seen where you are is when high school graduations could not take place during COVID, and that kind of really important transition to adulthood. Our community got really creative in how to celebrate those graduates and usher them into the next chapter through yard celebrations and signage, and the city printing the profiles of the graduates and hanging them on lampposts through the downtown area, congratulating that class. So that's one example that came up. And I think, Lindsay, you brought up a really great positive challenge that we can consider for other ways to do so here in Alaska.
And I love how you've integrated social connection into your community health needs assessments. I'm wondering, for the funders on the line, can you talk a little bit about how you've embedded it into your grant making? Are you asking, just very practically, are you asking grant writers to articulate how whatever initiative they're proposing might help to increase social connection? Are you changing your scoring criteria and weighing social connection differently? Just curious, how are you operationalizing that from the grant making perspective?
Oh, I was muted. Okay. You know, at this time, we've been really talking internal. I mentioned I'm part of the global team, and what we've really been trying to do is work internally to kind of socialize, if you will, the ideas with our colleagues across the foundation, getting them to think about it and move it into their grant making. I'm not aware of any cases where we've actually like put it in a criteria in our other calls for proposals, but I know that we've made our colleagues more aware, and they're looking for it within the grant making work they're doing. We're also looking at it within our well-being work, and our well-being work is another area that we're really thinking about across the foundation, not just as its own vertical. So at the Robert Wood Johnson Foundation, we're trying to do a lot more intersectional thinking, not just, we're working on one thing, so it's one thing only.
I would agree with you, Sharon. We haven't instituted any sort of particular criteria or put it into grant applications or requests per se, but we do discuss as a philanthropic team, where is that potential, or how is that project or that idea or that organization doing this work? And it allows us to then discuss with the applicant or our grant partner during, a site visit or some other conversations along the way, how they view that work happening. And it might seed some ideas, or it might call out things we hadn't realized about what they're doing. So as you said, Sharon, just having that present and aware in our thinking and in our conversations right now has been, I think, a tremendous step forward.
Thank you. Risa, what do you think are some of the most promising ways that philanthropy can support socially connected communities? And it would be great if, you could think about it from, the very large, very high capacity foundations to, what if I'm a foundation that has $10,000? What can people do at different levels?
Thanks, Lindsay. That's a great question. We're really hoping to continue to spur conversation across philanthropy to hear their thoughts as well, and so we can add to this list as we go. But I will say that, as I mentioned earlier, we know that philanthropy is often a perfect neutral convener of conversations, and philanthropy can really bring together partners in communities and host conversations in a way that can really somewhat take out the sort of heavy agendas that are often in the room when others are facilitating the conversation. And I think really lifting it up and ensuring that people have an opportunity to talk together about strategies that are cross-sectoral and community-based. So that's definitely one. We need more stories. And so any way that philanthropy can support story catching, story gathering and telling would be extremely helpful for all of us to learn from each other about what's working and what needs to be addressed in communities, and also for funders. I think, as we've mentioned, more research is needed, so funding research is important. One of our writing advisors of the report always answers this question with this answer, which is that often when nonprofit organizations write grants for work that they're doing, they can budget in some amount of money for the physical spaces where people gather, but there's never an opportunity to just ask for support to keep those spaces open and operational for people to come together outside of very specific restricted programs that are being funded. And so when that grant goes away, oftentimes those spaces have to close down or be more limited again. And we really do need gathering spaces for people, particularly once we're able to come back together as we once did in person, inside and so on. Otherwise, really helping to fund sort of creative approaches to utilizing outdoor spaces and thinking creatively about these collaborations, I think, is critically important. And finally, as we know, funding local community-based organizations for, advocacy work and to help support civic engagement, that too will be critically important.
You mentioned storytelling. Can can you talk a little bit about the photo voice work? And because I think that it's really compelling, and I just want to make sure that everyone who's on the call today knows about photo voice and what it can do.
Absolutely, and certainly Risa and Sharon, if you have more to add, please do, because I was not directly involved with it, but I got to see it unfold in our setting here. We received training for Photo Voice itself, and that is where you're empowering community to capture their stories through images, and then they come together and select the stories they want to submit to the prompts, of which we were focusing on health or challenges and barriers to health. And then they would put quotations with them as a group. So we had about a dozen community groups that opted into it. We trained them. We gave them the equipment. We fed them when they met. This was all pre-COVID, of course, in 2019, and supported them in that kind of in that creative exploration of their community or their group that they affiliate with. And they would come back and share that and talk with each other. And what was happening in that space with all those dozen community groups, just putting forth their images and why it mattered to them and what they wanted to say through those images, was really powerful. What we then did with it is created a photo exhibition, and we traveled that a little bit around the community, not as much as we would have liked once COVID hit, but we were able to have like an event reception at our office building and invite community in to hear from those community groups and take a look at all their images and read the quotes with them and put that together as a real pictorial catalog, which I think resonates more than reading a report with a lot of statistics and research embedded in it, which is wonderful, but it really speaks to things in a different way and allows more voices to be seen and heard.
Thank you so much to all of our panelists today. We are getting to the end of our hour. So I want to close by asking each of our panelists for very brief final words of wisdom. We had many, many great questions. So this portion of the program has to be really, really quick. So I'm going to start with Risa. Final words of wisdom.
That's tough. But I think this is just really all about human dignity and the fact that we all do better when everybody does better. So any way that we can collectively support a sense of belonging through creating these social connections, I think that it will make for a better health for all, better life for all.
Thank you. Amy.
First, I want to say thank you to Sharon and Robert with Johnson Foundation. Through the support of U360 as a global solution project, we were able to be a part of this work and connect to everyone. So that's wonderful. And I really just call out the recommendation of community-led solutions. I think our role in philanthropy to share and build power is really critical, and we're learning how to do that well and in concert with our community. Thank you.
Sharon.
All right, well, you've heard it all, but social isolation is the problem. It's been with us a long time. It will be with us, after COVID. The solution, as everyone has said, is a sense of belonging. It's community life. We've seen that on the streets and people coming together. And what town, what community doesn't want to celebrate community life? Just think about everyone in your community. So thank you very much. Thank you to my colleagues. Thank you to you, Lindsay.
And thank you to Risa Wilkerson, Amy Gorn, and Sharon Roerty for being with us today. I want to thank Grantmakers In Health for co-hosting this webinar with us, and again, the Archstone Foundation for their support. We'll be making today's presentation available to anyone who wishes to view it later, including the slides and the audio, so watch for an email to be sent within a few days. Again, I need to plug our annual conference, October 14th through 16th. Fully virtual. Many thanks to our local host sponsor, who's also Archstone Foundation, and please visit our conference registration website to learn more. Please follow us on Twitter, Facebook, and our new LinkedIn page, and please complete the brief survey of this program to help us improve future programming. And finally, thank you all for participating in today's webinar. Please be well.